Nebraska healthcare officials warning the state's nursing shortage could get worse. This comes as the U.S. Department of Education removes nursing from the definition of a professional degree.
Our Ron Johnson in the newsroom, he spoke to a nurse who could see a big impact from this change.
Brian and Jacqueline, right now the NHA says Nebraska is down about 5,000 nurses. With the recent news from the Trump administration, they say the state's ability to keep and train nurses could be threatened. Declassifying nursing as a professional degree means future nursing students wouldn't be able to rely on federal funds to cover the full cost of their degree. Right now, the cap is $200,000 lifetime. The change would make that $100,000 instead. The NHA says a typical advanced nursing degree costs around $170,000. They say this change could negatively impact access to quality care.
The biggest concern is that without access to higher loan limits, fewer nurses are going to seek an advanced degree, and those impacts may not be immediately noticeable, but they will be felt for years to come.
The NHA says rural areas will likely see the biggest impacts. I spoke with a nurse practitioner who works with Syracuse Area Health. They serve rural communities south of the metro. She says they already see the impacts of low staff firsthand.
There are just not enough bodies of people that are going into that. And then you're going to, if you limit that by limiting how much financial aid that they have access to, and then also like demeaning and demoting their professional designation, there's going to be less people going into that. And that's only going to drive our healthcare crisis worse.
According to the NHA, 73 of Nebraska's 93 counties have a below average nurse-to-patient ratio. 9 of them have no registered nurses at all. Now, we do still have some time before we see the impacts from this change. The federal caps are set to take effect next July. In the newsroom, Ron Johnson, First Alert 6.